Hi everyone, I am Taylor McFarland, a board-certified pediatric dentist and mom of 3. As a pediatric dentist, I have 2 additional years of specialty training beyond regular old 4 years of dental school, where I focused exclusively on treating and managing dental care needs in the child population, but that includes all children, so also children with disabilities. And I'm active on social media and I get a lot of DMs, people asking me if there are special considerations to be taken or special tools that they can use to help them care for their child's dental needs if, say, they are G-tube fed or they're orally averse. And I've got some suggestions today. I've just gotten this enough times that I needed to make a video, and I want to walk you through some of the things that I recommend in practice and things that I hope can help you at home just to care for your child with whatever they may need to help them make toothbrushing at home better. One thing I do want to emphasize is the importance of routine care. Even if you've got a child that's not taking anything by mouth, even if they're orally averse, you want to be working with something like an OT that can help you build that skill, because daily oral care for kids with disabilities and without, we are recommending twice a day toothbrushing, preferably using fluoridated toothpaste. You can adjust that amount if you're concerned with them swallowing it, but that is the standard recommendation, is brushing twice daily. If they're not able to do it themselves, that the caregiver is doing it for them. Now, a lot of children are averse to toothbrushing because of the sensations. It is very, very overwhelming for many kids, and so you want to try to decrease that as best you can. Sometimes toothpaste burn because of an ingredient called SLS, or sodium lauryl sulfate. So you can find a toothpaste that is SLS free. Sometimes it's also flavor sensitivity. Flavors are really powerful in kids' things, and some kids really don't like that. So there are flavor-free options. And let me show you some of my favorite toothpaste that I recommend. And all of these you'll be able to find below. Some of them I may even be a direct affiliate for, and I'll put that link in the description. So when kids don't like flavor or they don't like SLS, you want to look for a toothpaste that has no SLS in it. So some, like, this is a good flavor. A lot of kids like strawberry, but it still has SLS in it. But it's one you can find over the counter at a grocery store, which is nice. Most of these, though, you can still find on Amazon, the SLS free, the harder to find ones. These are my go-to 3 that are SLS free, and they have some really lovely flavors or lack of flavor. This is Dr. Bob. It was invented by a pediatric dentist, has no SLS, and has no flavor. It is only sweet, sweetened with xylitol. Oranurse is another toothpaste option out of Europe. It has a little bit higher concentration of fluoride, but not any flavor, and it's not even very sweet, but it's a little bit gritty in texture. Some kids don't like that. These 2 brands are my go-to for fun flavors. They've got blue raspberry, bubblegum. This has chocolate, orange dreamsicle. This one, the vanilla tastes like cake icing. They taste great. They're also good. Pro tip for moms, if you've got like aversion to mint with pregnancy and you're vomiting, kids flavored toothpaste can really help, but they have no SLS and they're fun flavors, so you're not going to have that foaminess. But you can adjust the amount of toothpaste that you're using if they really don't like the foaminess, because there's still usually a foaming agent even if it's not SLS. If they don't like the foaming agent, you could also just use a fluoride mouth rinse. So you can dip their toothbrush in a fluoride mouth rinse and brush with that. So this is Act Kids. You can use this one as a fluoride mouth rinse. There are also the brands Closest and OxyFresh that have a fluoridated version. This is not the cavity protection version, has fluoride in it, and something called chlorine dioxide, which has been shown to help a little bit with bad breath development. So if that's something they're struggling with and you want more than just fluoride, that's something you can explore. There's also some research showing it may benefit with gingivitis. Another mouth rinse that's up and coming is something that has nano silver. I'm still a little hesitant about nanoparticles, especially a nanoparticle metal, but I've talked a little bit with the creator Elementa of the nano silver mouthwash, and that may be something to explore and talk to with your dentist and look a little bit more even on Elementa's page about the safety data about nano silver use, but that might help too if they really struggle with gingivitis. So using a toothbrush, or if they don't tolerate even a toothbrush, you can use like a tooth sponge to wipe their teeth, but that's not going to scrub as efficiently. Ideally, you would get a true nylon bristled toothbrush. If they can't stand the feeling of a traditional toothbrush, you can try something like a triple-sided toothbrush. This is called Surround by Specialized Care Co. Curaprox is another brand that has great alternative toothbrushes. They use Curin filaments instead of nylon. They're smaller and they just have a different texture, different feel that a lot of people are able to tolerate better than a traditional toothbrush. Another method that is helpful is often something like a U-brush. Auto brush is the only one I know that has 2 sides, true nylon bristles, and it gives you the best clean of a U-brush. It's still not my favorite. It's going to miss the molars. Don't use this and use this alone, but it can be a good gateway tool for a kid who's not tolerating brushing that can get you better than nothing. And then you want to just be sure in the few seconds that you have afterward of using this that you sneak in there and brush the molar, cheek, and tongue sides really well, because those are the spots that these miss. Another challenge with caring for teeth, especially independent care as as a child gets older or even as an adult is hand grip. So you can modify a toothbrush handle. An electric is going to be thicker, easier to grab, but I've got a video I'll link for you that shows how to modify this with like a pool noodle and even a Velcro strap around to help with grip. But something thick can really help make that more accessible. And then the electric one, the beauty of it is it brushes for you. You're literally just moving it around. You don't have to do all the scrubbing. A great accessible tool that I love, and I'm actually an affiliate for, is the Sulfate flosser, and you have the same idea as with an electric toothbrush. So you're getting a little bit better grip from that handle, and it's just easier for someone to use. Whereas string floss, as you know, it's really not something, if you have any dexterity struggles, you're not going to be able to use. So this makes flossing a possibility for a whole slew of people that it really wasn't a possibility before. Those little floss picks, often too difficult to grab, and this is a floss pick essentially with a handle. And the cool thing is it's electric, it vibrates, so it gives you even a little bit more thorough clean. A couple more toothpaste I want to talk about. A lot of times for kids who are G-tube fed, they get a lot of tartar and calculus buildup. And so one toothpaste that may be an option is something called Tartar End. This is Tartar End. I really like it because it can help with routine use to diminish the bonds between tartar in itself and then tartar in the tooth. And over time, people have noticed decreased periodontal disease and loss of tartar. This isn't like an ADA endorsed toothpaste. It uses ingredients. It doesn't have fluoride for one, so you want to also use a fluoride toothpaste, but it uses things that the ADA has not investigated or done studies on. I'm sure those will be up and coming, but this is something, if they really struggle with tartar buildup, is something you can try. It's also really mild in flavor, so I like that a lot. If you are hesitant about fluoride, there is the option of something called nanohydroxyapatite. My caution, again, as I mentioned with mouthwash, with nanoparticles, is they're small, they're more reactive, they can go unusual places in our bodies, and the shape matters. If they're like a needle-shaped, so pointy-shaped nanoparticle, they have a lot better ability to do not great things. And so you want to be sure that the company you're using has a good reputation. It's not just some random new company 2 years in the market on oral care products. You want someone that's been around a while. So CARIFREE is my go-to. I just became an affiliate for them, even though I've been talking about them for years. So I'm like honored. And I love this brand. I personally use it. And they have not just nanohydroxyapatite toothpaste, and you can get one that only has that. They also combine it with fluoride. And that's where it's beneficial, because it is not a replacement for fluoride, in my opinion, although it's better to use that than nothing if you don't want to use fluoride. But hydroxyapatite is what's naturally in our tooth. Nanohydroxyapatite is the small particle size, so a smaller version of that. You're going to get smaller particles going deeper in the tooth and remineralizing. But if you can use both, you get the benefit of fluoride, which is an outer shield of protection on the outside of your tooth, helping resist future acid breakdown. And it's acid that breaks down our enamel. It comes from bacteria, it comes from our diet, and that's what weakens our teeth. And this can help protect it. So the fluoride can help prevent acid breakdown, and then the nanohydroxyapatite remineralizes and re-strengthens it. So I love CARIFREE, highly recommend. But if you're worried about fluoride and being swallowed, you can try their fluoride-free nanohydroxyapatite version. It is the only version that I really recommend. Another one out there, Boca, seems fairly legitimate. You could try that if you want to, but personally, I only go with CARIFREE. Other recommendations would be just to help lower cavity risk by minimizing carbohydrates in the diet, especially ones that stick to the teeth and stay for a long time. For drinks, you want to avoid really acidic or really sugary things, especially frequent exposure to them. If they need something for weight gain that's high in calorie, high in sugars, something like Pediasure, you want to just make sure you're trying to clean those teeth off afterwards, either brushing or just having them rinse with water. You just don't want it sitting on their teeth. And the reason you want to clean someone's teeth, even if they're G-tube fed, is because these kiddos, especially kiddos with some disabilities, are really compromised by oral bacteria. They can aspirate, it can go to their lungs, it can make them very sick. And so you want to brush daily, reduce the amounts of bacteria in the mouth, especially the bad ones, by disrupting those plaques that form in there. And that is going to protect them in the long run from the risk of having a high viral count, yeast and fungal count. All those things, they're diminished by regular oral hygiene. So you're protecting them overall by keeping their teeth healthy, even though it may seem like they don't use their teeth, they're not eating anything by mouth, but you want to decrease that amount of bacteria, viruses, fungus by brushing daily, making them better protected in the long run from some negative outcomes that could come, even if it's not cavities. One other toothbrush that I really like that has a wide brush head is Radius, and I'm going to show a picture of that, but you can use that along with a triple-sided toothbrush as another favorite of mine. If you struggle with your child clamping down their teeth, you can use something called a brushing buddy if the child is small. This little tail serves as a bite block that can fit in between their teeth. Another option is a mouth prop that can be opened a little bit wider. I'll show an image of those, but you can use those, press them in between their teeth and rotate. That's often what we use in the clinic to be able to clean the tops of the teeth pretty quickly and then get out of there. A triple-sided toothbrush can be really helpful in those cases. If they're not opening at all, you can use something called retromolar pad pressure, where you bring your finger back to the back of their mouth behind their molars and press down. And that will get them to open, so you can put that mouth prop in, place it there, and brush. I hope this information has been helpful. If you have any other questions that I didn't answer, please ask them below in the comments. And if this was helpful, hit subscribe and like. And I want to just thank you so much for being here, and check out this next video. It's what YouTube thinks you'll enjoy.